Yeah, actually, it's a lot. When you think back 36 years, it seems like just yesterday. You started in public health, you're looking at all the new challenges. There's a lot of good challenges, a lot of good things I remember, and also certain things that, kind of facing like quite negative, such as amalgamation is something that at that time was almost like a dirty word for the city worker. But anyway, just to give a few examples that before amalgamation, I remember that the province passed a new regulation, or they call it the Tobacco Control Act, is to how to enforce to prevent young people start smoking and buying tobacco product. So I remember that it's 1994 in November when the province saying that, okay, here's a piece of legislation, do something about it. At that time, there's lots of confusing about, okay, what do you want us to do? We're not police officer. How are we going to enforce, tobacco sales to minor, that type of process? So I remember sitting there at coffee with Wolf Sexler. I used to work with Wolf Sexler in Etobicoke forever. That we said that we need to do something about it. If not, guess what the province would say to us, right? So we brainstorm a little bit. I just asked my boss at that time, the director. I said, hey, listen, give me a couple of weeks. I'll come in, I'll dress down, I'll do some surveillance, and I'll develop a process for enforcement. So within 2 weeks, caught a kid buying cigarettes from a variety store. Wolf and I actually laid a charge, and that was become the first prosecution under the Tobacco Control Act in the province. Oh, remember, just like yesterday, That was late 1999, the beginning of 2000, that, again, there was a series of media articles, such as the Dirty Dining from Toronto Star, that starts stirring up a lot of public emotional reaction from the public about health inspectors not doing their job, or they're not doing a good job, that type. So in order to do that, the previous late medical officer of health, Sheila Basher, pretty much one day said to us, the healthy environment management team, saying, oh, we have to do something about it. The media is eating us alive, and every day we have a Dirty Dining article about something's not done right or done poorly. So based on that, we brainstorm again. We're just saying that, hey, look, we can't keep fighting to use what system that we used to use before amalgamation. Let's start from scratch, let's develop something. So that developing something idea is giving birth to a program called DineSafe. I would say that as a happy outcome, because initially when DineSafe was first implemented, that's January 2001. For 2001, the compliance rate was only 78%. That means that through the whole year, it's only 78% of the food premises completely pass all inspection. Okay, it slowly gone up to around 80 to 85% around 2004, 2005. But for the past 6 years, the compliance rate been over 90%. It bounced between 90 to 91%, and it was a great success. We would like to see it go higher, but in reality, in Toronto, we have over 17,000 food premises inspected by a team of 80 health inspectors. So for sure, some of them will not be in compliance, or we do have a small percentage of operators seems to be just have some difficulty in being full compliance. But when we're talking about less than 10% of them receive conditional passes, and really less than 0.1% that receive closure, I would say that the result is really good. The compliance is really high. Wow, a lot. Because, like for me, for the longest time, I always try to separate the job and the career, because we have to look at those as two different things. A job is something that we got paid to do whatever we're being told to do, but career is something that you develop yourself. Other people cannot do it for you. So by looking back, I would say that, when I was a health inspector out in the field, you just want to get your inspection done, you just want to go home. And then I realized that there's so much to learn on the job. Because if somebody got sick, I need to find out why they got sick. What caused the problem? Can I do anything to prevent it? So by looking at that kind of challenges and then start developing, start learning, start doing researching, and learning something new on a daily basis, I would say that that really helped me in later years to be successful on the job. So just by looking at the job is a job, but the career is something that you develop, and you need to do both. If not, you'll be just doing a job, go home, come back to work, and you will never get anywhere. So something rewarding is to actually see the light at the end of the tunnel. Okay, when you first started something, it's like, oh my God, I don't know how that's going to happen, or the media are going to eat me alive and things like that. But again, if they look at it as a challenge and do the best you can to overcome it, okay, like every problem has a solution. You just have to look for it, right? And when you find a solution, when you achieve something, when you see something actually become successful, that you can actually, that feeling is priceless. It's called self-satisfaction. You don't need people to tell you how good a job you are, because why? You know that you have done a good job.